Good evening, everyone. Welcome to the Down Syndrome Action Plan. I'm really excited for today's conversation. Dr. Elizabeth Hesse-Sheehan is someone whose work I deeply respect, not just for what she knows, but how she shows up for families. She's a chiropractor with more than 25 years of clinical experience and the founder of Experience Health, an integrative practice that supports individuals and families navigating complex health needs. What I appreciate so much about Dr. Hesse's approach is that it's truly nervous system informed, and we're going to talk about that a lot today. Deeply practical. Her work blends regulation-based tools, functional nutrition, and highly individualized guidance to help families create real and sustainable change for everyday life. She has postgraduate training in clinical nutrition and neurorehabilitation, including a 3-year diploma program in clinical nutrition, along with advanced certificates in quantum neurology rehabilitation, methylation, and autonomic response testing. In addition to her clinical work, Dr. Hesse has also been a teacher and a mentor through the Klinghardt Academy and has contributed to educational work in the areas of complex chronic illness, including autism and Lyme-related conditions. She's a real gift for translating complex topics into clear, actionable strategies that caregivers can use right away to support calm, connection, and resilience. And I'm very grateful to have her here today. Welcome, Dr. Hesse.
Thank you. Thank you so much for having me. I'm very excited to be able to speak with you today. And I am a big admirer of you and all of your work and everything you bring to our community as well. So thank you.
I have this thought in my mind. The most impactful people that I have found on this path are always brilliant clinicians, brilliant thinkers, but they also have that lived experience. And that's
Yeah.
what makes all the difference because it can sound good, but unless it's able to be applied.
Yeah. I worked heavily within the autism community for the first 15 years of my practice. And worked with so many families, and I would have intensives and people would fly in to see me to do a lot of quantum neurology rehabilitation work and all of that. And I really thought I got it. And then I had my own child, Connor, and got his Down syndrome diagnosis 2 weeks after he was born. And I was like, well, at that time, I was just like, ooh. But, looking back, and I'm like, oh, yeah, I totally did not get it until I physically got it.
I think that's a very common story. I always thought I was a great occupational therapist until Lucas was born, and then you reconsider everything.
Everything. Yeah.
So let's start with nervous system regulation. Um, if you're not on this journey very long, as your child grows, before there comes a point where there you see behaviors and there's this conversation. What is a behavior and a behavioral approach versus something that requires neuro support? So, what do you think is the most important thing to understand about nervous system regulation?
Well, let's first start by defining what nervous system regulation is, just so that people have an understanding of that. And nervous system regulation is the body's ability to move in and out of stress and then return back to this sense and this feeling of safety. It's how the brain and body decides, am I safe right now? And that is a crucial question and a crucial state of being, because a regulated nervous system is what allows for rest and learning and connection and recovering. And behavior is often the output. We hear all the time behavior is communication, and it is, but the nervous system is the driver of that output. The nervous system is that communicator, and the way that the body communicates is largely through the nervous system. So it's important to have that nervous system regulation piece in place. And it's not something that you can force or come at with an energy of fix and hack and push and resist, because the nervous system, in order to become regulated, it has to feel and be in a position of safety. And it's not about nervous system compliance, and it's about nervous system capacity. And does the nervous system have the capacity to regulate and to flow into the different states it needs to be able to do the other functions that we need it to do? So when the nervous system feels unsafe, then learning shuts down and cooperation shuts down and things shut off. So when we look at our child and behavior from a nervous system standpoint, we should be asking, what state is my child's body in versus why are they doing this? And let me tell you, I mean, very guilty, very guilty. I would say Connor's, I don't know, Connor's challenges, maybe they're my challenges, is largely around behavior. And so, this is a multi-layered journey for me. I've got the clinician side and the mom side and all of that. But yes, and so it's about, is my child's nervous system, is their body in a place where they feel safe or not? And then once regulation starts to improve, then we will often see many behaviors start to resolve on its own.
I feel like with our children, particularly who have Down syndrome, who have, multiple kind of input-driven disturbances in the way they relate to their sensory experience, that feeling of physiological safety is so vulnerable. It doesn't take very much to flip them into a flight, fight, freeze response.
Yeah,
And, the stereotypes, if I never heard it again, I would be thrilled, but our children are stubborn. Being
yeah,
stubborn is a really classic freeze response. They're
yeah,
overwhelmed, and
yeah,
eloping and running and all of these
yeah.
things. So, from your perspective, um, why do so many individuals with Down syndrome live in a state of chronic nervous system activation? And what are some of the more common contributors that you see?
I love this question, and it's not usually any one thing. For me, this is another one of those multi-layered things that I see and I experience when I think about the Down syndrome nervous system. So we've got prenatal and birth stress and the early nervous system imprinting that happens during pregnancy. So, I mean, just thinking about a child with Down syndrome, and I think about also very much through a biochemical lens, but also through an energetic, intuitive lens. But from a biochemical perspective, uh, the nervous system isn't being laid down properly. It's already under attack. We know that most pregnancies of a child with Down syndrome spontaneously miscarry. So, from that perspective, I'm thinking that, their body is already in a state of fight, flight, survival from conception.
Yeah.
And then they don't have the nervous system scaffolding uh, to help with that nervous system development as well. And then if, the mom gets a prenatal diagnosis, and if for her experience it's a traumatic thing, which unfortunately in our culture, that's where we're at, that can create some nervous system stress throughout the pregnancy. And then, of course, once the child is born, we often will have a lot of issues with medical trauma, medical procedures. There's even more stress. There's the issue with, even if you have a post-birth diagnosis like I did, then there's the getting the news and how the doctors and nurses and people are coming in. Are you with me, Geraldine?
I am.
Okay. Sorry, my feedback changed, so I wasn't sure what was happening there.
No, I am.
I mean, I've heard one of the things I do with my patients, which is usually the mom speaking on behalf of their child, is I want to hear the diagnosis story and the birth story, because I really like to witness that experience for them. And a lot of times we'll do some type of trauma work around that, because for so many mothers, it's a traumatic experience for them. Even if they're not personally affected by the hearing your child has Down syndrome, a lot of times they're, dealing with the, well, we all are, but how that news is being delivered. And for so many of the mothers, the constant pressure to abort and all of that kind of stuff. So there's a lot of nervous system stress and trauma around that, which of course the child does pick up on whether they're in utero or have been brought earthside. So that's a big deal to me. And then, of course, once they're here, we know that there's issues with sensory processing. We know there's issues with muscle tone and posture. We know there's issues with airway and breathing patterns. All three of those things are very big influences on the nervous system's ability to regulate properly. There's increased sympathetic tone and slower parasympathetic recovery. As they get older, they're being asked to function in environments that are not necessarily designed for their nervous system. There's this chronic effort that their body is having to put through to function, not only from like a nervous system level and the nervous system fatigue that comes, but also I think biochemically and how hard their body is working to compensate for all of the biochemical stuff that is going on. And those biochemical things are a real big factor, from nutritional deficiencies to neurotransmitter and hormone imbalances to a lot of kids with Down syndrome tend to have gut issues. And if we're talking about the vagus nerve, which we will, 80% of the information from the vagus nerve is from the gut back up to the brain. So gut health is a really big thing. The oxidative stress and the inflammation and the mitochondrial dysfunction that's pervasive in Down syndrome, and unless we're helping to support that, there's just so many different factors that contribute to nervous system dysregulation for a child with Down syndrome.
And I think part of why it's so important to be having these conversations and to be pushing these topics out into a space where parents can understand it first is because there's still, despite all the decades of that have been that have passed from the time the extra chromosome was first discovered to now. Kids with Down syndrome are painted with a broad brush. Down
Yeah.
syndrome is seen as something that there's nothing new under the sun and they're all the same. And
Yeah.
you can see in the medical research, anytime there tries to be a therapeutic intervention, how could it ever be statistically significant? Because how could you ever find a sample size of children similar enough? I think there is
Mm-hmm.
such a wide range of things that can be different and out of balance and
For
excessive or
sure.
deficient that you could never find a sample size large enough of children who are similar enough with Down.
Absolutely. And all you have to do is start, getting involved in the Down syndrome community and meet even 3 kids with Down syndrome to realize that, oh, they are not all the same.
The same.
There's
No.
very different wide ranges of expressions and presentations. Yeah. And it's tragic that there still is this push to abortion and there still is the, oh, your kid's never going to read. I've even heard parents be told your kid's never going to walk. Some of this stuff is just like so ridiculous. And if you don't, and I would guess most of us do not have a large background of being with people with Down syndrome. So you hear those things and it is very traumatizing and it's very scary.
Of absolutely. And we'll talk about it a little bit later. But I mean, one of the things that I'm so passionate about is co-regulation because
Yeah.
you hit it head on right early. We once this baby is born, the system converges like, well, we have to do the medical test and figure out everything about the baby. And what is our role as mothers, right? Our role as mothers is to have it all together and to make it all okay for our other children and possibly
Yeah.
partners and any of these things. And we are traumatized.
Yeah.
We can absolutely get our heads around a diagnosis of Down syndrome, but it's a trauma. So
Mhm.
Co-regulation is a huge topic that I feel very passionate about as well. So, when we talk about all the things that come into the child system and from the child system that keeps them in this elevated
Yeah, big
state
red
of
fish. Right.
sympathetic function, I'm very sorry.
It's okay.
Uh, I don't know. I'm not sure where that's coming from, but I can find it. Um, when we talk about all of the things that are coming into the child's system and from within their own system, from all the different issues that you just touched on, and so many more that we haven't, there then is that how that responds in an output, how the vagus nerve is impacted, what that means to what goes on after. So, if the child is constantly in a state of sympathetic activation, how that relates to where they are or to what they're doing. Can you explain the vagus nerve's role in regulation and why it is so central to regulation, safety, and emotional responsiveness?
Absolutely. So the nervous system has two big sections, two big functions that it does. You've got the sympathetic nervous system, which is best known as the fight or flight nervous system. That has definition has been expanded to fight, flight, freeze, fawn. And then you have the parasympathetic nervous system, which is responsible for digestion, detoxification, rest, recovery, regeneration, being able to get out of that fight or flight, fawn, freeze, and into, okay, danger's over. Now we can move into this part and start the recovery process. And the vagus nerve is kind of the gateway or gatekeeper to the parasympathetic nervous system. There's lots of different things that influence nervous system regulation, and I have a graphic. It's like an umbrella, and the different spokes of the umbrella are different pieces of nervous system regulation, like hormones and neurotransmitters and gut and structure. But the handle of the umbrella, the thing that holds up the nervous system and allows that the rest of the umbrella to open up, is the vagus nerve. So the vagus nerve is that main pathway of safety and that main regulator for the body being able to rest, digest, heal, repair, recover. So it innervates the back of the palate, the throat, the heart, the lungs, the gut. So it's a really big nerve and has a really big influence on your nervous system. And it tells the body, am I safe or do I need to protect? So strong vagal tone and things that support the vagus nerve are good. They're help with emotional flexibility, with digestion, with sleep, with social engagement. I recently made like a checklist of all these different systems that are influenced by the health of the vagus nerve, and it's really large. And if you, I think for a lot of people, if they look at that checklist and they look at their child with Down syndrome, they'll be like, "Oh, gut, oh,
Everything.
anxiety, oh, poor sleep." And I'm not saying that the vagus is the only thing that's contributing, but it is a big contributor, because if you're trying to help your child's body heal, then you've got to make sure that that vagus nerve is intact and is working so that they can shift into that part of the nervous system. So it's not something that you control, it's something that you signal and help support.
I think just from my perspective as, an occupational therapist and now diving deeply into neurodevelopmental concepts, I feel like the sense of interoception in general is overlooked completely.
Mhm.
And if you consider, our children that might have these, they can hear their heart beating in their ears, they
Yeah,
might be constipated, they might be constantly hungry, you then, start
yeah,
to realize how that impacts so much
yeah.
more.
And I think there's so much more in it than people realize. and I think this is from talking and observing, of course, so many kids with Down syndrome over the last 11 years. But um, I'll ask in my group, you know, do you think your child has anxiety? And so many people are like, no, no, my kid's not stressed. My kid doesn't have anxiety. And I'm like, but the gut shot off, they're not sleeping, they're biting their nails, they're pickers, they're elopers. And these to me are all like, okay, maybe anxiety isn't, they're thinking anxiety looks one way. And I'm thinking, I guess, more of nervous system dysregulation. But I feel so many of our kids are having nervous system regulation issues. And so bringing more attention to that and more awareness of what that looks like, then parents, of course, will have tools, be able to have tools available to help support their child.
I love that you said that because you're absolutely right. And that's why these conversations are so important. To ask someone, do you think your child has anxiety? The answer would be no, because
Yeah,
their
I learned
frame of
that. I,
mind.
I learned that pretty quickly. I was like, what?
So defining what anxiety looks like, and actually that's a really good bridge to my next question. We all can wrap our heads around what it might look like in a 6 or 7-year-old, but what are some of those early signs, maybe babies, before we have classic quote unquote behavior things to latch onto? What are some indicators that they might be having some difficulty with their nervous system regulation?
Yeah, and a lot of it is vital sign type of stuff. So things like heart rate, breathing changes, sleep issues, increase in startle response, um, kind of fatigue or checking out, appetite shifts, posture, if they're kind of tense and tight and holding themselves rigidly is another one. Eye contact and facial expression. And then, of course, as they get older, loss of previously mastered skills, needing more reassurance or more repetition. These are some of the things that we can see as the nervous system is getting overwhelmed before it actually translates into a defiant, stubborn behavior.
Gosh, I feel like we could have like 3 hours more of a conversation because this point alone is so critical when you think about a child who is turning school age and now they're entering a school environment. And if there's any nervous system dysregulation beforehand, going into a new environment with the new expectations and the new sounds and all of it, it can be so overwhelming. And then we feel like everything is so output measured and output
Right.
based. Their learning really kind of takes a backseat to then trying to maintain them within a classroom or trying to maintain, quote unquote behaviors.
Well, it's actually a gift for the kids with behaviors because they're like clearly showing you
Yes.
things aren't good.
Yes.
For me, I'm more concerned about the kids that aren't as prone to show behaviors. And what does that mean? I mean, maybe they're just better at adapting, so it's not a big deal. Or is it that they're like really stuffing everything and it's going to kind of blow up eventually type of thing? If you've got a kid who's trying to escape the classroom or hide under a table or gets up and tries to leave, at least
You see it.
yeah,
But masking is a very real thing, and our kids
yeah,
are very good at it,
yeah.
especially those, the more reinforcement type programs that they have. If they want to collect whatever the thing is that's being promised, they're really good at masking. They're not learning anything, but they're, keeping it together to comply.
Yeah.
Um, One of the things that you emphasize is gentle somatic and sensory-based practices. Why is this so important? And I know you've already talked about in the beginning, if we're not in tune with ourselves, we want to make this happen so much. We're like pushing and we're
Yeah.
anxiously trying to help. Why is that gentle co-regulation so important?
So co-regulation is definitely important because a child borrows their parents' regulation until they can access it themselves. And it's our job as parents to model regulation and help teach that to our children. So, a regulated nervous system is going to lower threat signals and help to speed recovery. Your a parent's tone, their breath, their posture, their pace, their presence matters more than words, especially in a child with Down syndrome that is likely going to have auditory processing issues
Mhm.
anyway. It's not about being calm or perfect all the time. It's just more about that willingness to return. We're all going to lose it. We're all going to get frustrated. The question is, can you then model what it's like to come back? Which is very, really important. Model that for yourself, model that for your child. Because initially, I mean, if you've got a baby, you're going to need to just start modeling a lot of this. There are exercises that our kids will be able to do themselves, but part of the modeling is teaching them to do them even when they don't want to do them. That's the resistance piece of it. And regulation, as we know, is contagious. It goes back and forth. You could be having a bad day and then your kid's going to start acting out. Or if your kid's having a bad day, that could cause you to act out. So having someone having that ability to regulate their own nervous system is really, really important. And when it comes to regulating the nervous system, gentle is, of course, extremely important because if you're coming at nervous system healing with any type of force or hard energy, the nervous system is going to perceive that as unsafe and block the healing, block the regulation. So it has to be done in a way that's gentle, predictable, slow, relational, connection. Small inputs often create more lasting integration. Just like with everything else neurodevelopmental, right? There's the frequency and the duration and the intensity, but not intensity in the way of push, 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 but more of the intensity of the consistency
Consistency.
of doing the practice. And this is, of course, very important for a lot of our kids with Down syndrome that have sensory sensitivity issues because they're going to be more sensitive to all of the different nervous system stimulants. And I feel like a lot of our kids, there's a sensitive nervous system in regards to like smells, lights, sounds, but I feel that many of our kids also have a sensitive nervous system in regards to energy and
Mhm.
frequency.
Mhm.
A lot of our kids are super intuitive
Yes.
and if they're verbal, like my kid is, he'll call you right out on your stuff. No filter there.
Yeah.
So, a lot of our kids are intuitive and empathic. And from an energetic perspective, we are very enmeshed in our kids' energy fields more so than with our other children because we have to be. They have, there's that extra level of need and support that are needed, but that can create some enmeshment. And I talk a lot with patients about also learning to pull back your energy and let your child have their own energy and kind of don't be up in their energetic business all the time. And some kids are much more sensitive to that than others. So when it comes to nervous system regulation, we need to build trust with the body versus trying to override it. And I was reflecting on this, and like I think that's kind of why sometimes neurodevelopmental approaches don't end up working, and like either parents or kids burn out because we're told from that perspective, frequency, intensity, duration,
Duration. Eight
and
hours of programming. Get
it's
on
a
it.
lot. And a nervous system that is not ready for that and is struggling with that. And then all of a sudden that becomes not safe. And so then we're seeing shutdown, and that's not something you can ram through. It really made me think about Connor's history and how I probably didn't always approach his neurodevelopmental stuff in the best way with trying to honor his nervous system all the time because I was, trying to reach all those program goals.
Well, and it's so true. If anyone here has been following me at DSAP, the last year I have just been over my head and fascinated in everything cerebellum. I think it holds the key to so much. It's the connection of that brain body. It's got inputs and outputs to the vagus complex as well. But what I'm finding is, and I was the biggest believer that intensity, frequency, duration, and repetition, and all of that. And it's such a cortical model. It's such a model of connecting the different parts of the cortex, which of course is important. But when going back to what you said in the beginning, if we don't build that foundation and our children's, cerebellum, their sensory system are uniquely impacted. And so their ability to regulate is going to be uniquely impacted. I am really coming around to the less is more, the
Yeah.
regulated, intentional intervention that's safe. It's, that is where that neuroplastic change is going to happen.
It's so challenging, both as a clinician and as a mother, because I'm like, God, there's so much we got to work on. you know, there's so many pathways and so many things that need support. And you want to try to touch all of them and hit all of them and give those inputs because the nervous system does need the input. It does need that help with the connections and all of that integration. It does need that support, but it's finding a way to do those supports in a way that the nervous system isn't feeling threatened and then shuts down. And then, and then if your child's refusing to do program with you, I mean, that's
That's
probably a big
thinking.
piece of where to look at
How,
versus
remind me, how old is Connor?
he's 11.
He's 11. Okay, so Lucas is 18. And
Yeah.
if I can, this another sidebar conversation for another time, but if I can just impart any wisdom, Lucas was about 10 or 11 when I came to that realization. The early part of his life was all about neurodevelopmental programming. I'd get the
Yeah.
other boys on the bus at 8 o'clock, and from 8 to 2:30, Lucas and I, we were on. We did it.
No.
And then you get to the point where you're like, what am I accomplishing? I'm stressed out. He's
Yeah.
got to be feeling it. And it morphed into this situation where we were in it together. Lucas has been on a walking and running program forever. We walk and run together to this day. It's what we do. We're partners in it. You're just going to grow and develop in really a beautiful relationship as your child gets older. And I think that you're just so amazing. And I know so many parents put so much pressure on themselves, like to do
Yeah.
everything and do everything right. And I think honestly, we are exactly what our children need. And we just need to kind of remember that and honor that because we are. I mean, I have a wonderful relationship with Lucas, and as he's getting older, it's just getting better and better.
It's it's such, I mean, this journey is so fascinating to me because it's really this kind of almost walking a tightrope of doing everything you can to help support them. But at the same time, you also just have to let some stuff go and realize that everything's going to work out the way it's supposed to. And yes, you don't give up. Letting go does not mean giving
Not
up.
right.
It's a different space. But yeah, Connor and his nervous system let me know very early on that he was not appreciative of them. And so we were very stuck for a while of, oh, Connor and his behavior, and Connor's so stubborn, and I'm making this fun. Why isn't
Yeah,
yeah,
right.
right. So yeah, it's so now, we've taken a step back as well. And it's more of and that's what I had to do too. I'm like, I got to take a step back from all this and I need to work on our relationship because we're at a point now where all we're doing is butting heads and we're
Yes,
fighting
yes.
all the time. And that's not what I want for us. So that's what I did. I took a really big step back from the neurodevelopmental stuff, still was doing some, and really focused on rebuilding our relationship because I had felt that what he was trying to tell me was, I lost his trust. I lost his trust. And so, yeah, that's what we did. We worked for a long time on rebuilding the
I love
trust.
that. I feel like the year 10, 11, that's where that I've talked to so many parents on this journey of neurodevelopment and everything. We all get to that year 10, 11, and it's kind of a game changer. They're old enough that we're seeing, what we need to change. And we know in ourselves once you're doing it for a decade, you're like, okay, this isn't, we're gonna kind of switch this around a little bit.
Well, Connor must be a early on that one because this was like age 7 or 8 that we.
I love it. I love
But
it.
I will say, I feel like right now our relationship is the best it's been in a very long time. So that pulling back and focusing on connection and trust and safety has done a lot for his quote unquote behavior.
That is a great segue to actually getting back on track to our questions. We talk a lot about using breath, posture, rhythm,
Yeah.
support. Talk a little bit about that and how that interfaces with keeping the nervous system regulated.
Yeah. There's a lot of different things that we can do to help support our kids, that you can do together. And breathing is an example of one. And depending on where your child is, they may be able to follow something like a very simple and easy box breathing, or you might have to start with teaching them to blow out a candle because that exhale is very good for helping to support the nervous system. Rhythmic walking, but I think even simpler is rocking.
Mm.
I think we all need to get back to having a nice rocking chair and rocking our children when we can and rocking ourselves and
Yes.
modeling for our kids. Oh, you're having a rough day, time to go sit in the rocking chair. um, I am a big advocate of layering things. So like our rocking chair also has like a sheep skin on it, and we'll, use essential oils or something like that because I like to give the nervous system lots of very gentle, soothing support. But rocking, I think, is so huge. Um, Humming and sighing. I know it's a funny thing because, we're always so focused on speech with our kids, right? And trying to help get them to talk. But I think early on, teaching them to sigh
Hmm.
is would be really great for their nervous system and help teach them that there's something simple and easy that they can do to help regulate themselves. Teaching them about putting their hands on their heart and checking in with their body. Um, I made a video a long time ago called Spinal Flush and Zip Up. Doing that with your children, teaching your children to do that on you is very good for regulation. The butterfly hug, alternating rhythmic tapping
Hmm.
for a minute to 3 minutes is something that you can do for yourself and model it for your children. As an energy healer, a lot of I talk to my patients a lot about you can do something to yourself, holding the intention that I'm doing this for my child. Things like tapping, all
I
sorts
was
of
just
things.
going to ask you about tapping.
Oh, I love tapping.
Yeah.
I love tapping. But yeah, just even doing this. So initially just modeling this, because if you have a child whose nervous system is already dysregulated, they're not going to let you in and start tapping on it.
Right.
So the first step is just being, they're watching TV, you're over here rocking and tapping. And just having it not be a big deal, not pressuring you to do this, not asking you to do this. You're just going to be in this space and start to learn what it feels like when I do this. And then usually after a bit of time, then the child will start to pay more attention and maybe allow you to start doing more stuff with them and start doing it for themselves.
Randy just dropped a note in the chat that says Sesame Street has a series of books called Monster Meditation that help them a lot. They teach
Oh,
different
cool.
breathing techniques. That is cool. I've never heard of it. One of the things that I did for a period of time, I was doing early intervention OT. And I actually found this book written by an OT. It's called Intuitive Development.
Oh, yeah, I think I saw that book earlier this
This
week.
is even if it's written by an OT, but it's just brilliant. So many good ideas. With my little guys, I would just lay on the floor with them and take one of their favorite, stuffed animals or whatever and set it on their belly and just quietly
Yeah,
watch the animal go up and down. Um,
right.
with your own child, wrapping in a blanket while you watch something or hum together, or you hum and
Yep,
let them feel your
feel it.
vibration. All of those things are, and again, not only so regulating for them, but for us as well, right?
Right.
I love that whole mindset of nervous system regulation.
Yeah.
So, what do you do when you've missed the window and there is an all-out meltdown? How do
I
we?
wouldn't know. I've never had that happen.
I know, but if you could imagine it, it happens once in a while.
Yeah. So this is where the big thing is to slow down. Slow down. Lower your own nervous system first. Fewer words, slower pace. You want to make sure that there's physical safety before you begin emotional processing of any kind or talking of any kind. Stay nearby without demanding interaction. It's holding space. A lot of times, what that's called holding space for the person to go through what they're going through as long as it's safe and be that calm, that centered, calm, present space that they eventually will be able to co regulate with and kind of come back to. And you need to be regulated before you can start cognitively, before talking, before trying to reason, before questioning any of that stuff. Everything has to have come down a little bit. You cannot start talking at them and instructing or whatever while they're in this dysregulated state. And that's for every kid. It's funny because we talk so much about Down syndrome, but my other daughter, she has ADHD and executive functioning issues. And we actually oftentimes have to do more emotional regulation stuff with her than we do with Connor. So it's really, that's been very interesting. And just knowing that, okay, Danica's emotional because they just had a big game that they lost. No talking, no talking in the car about it. Let's just, breathe, keep it light, and
It's
wait
so
for her
interesting.
to get back into a place where then maybe we can engage and see if she wants to talk about it. Um, we've done a lot of breath and just breathing, and not like, fancy breathing, just even take a breath. And it's great. I know it's worked because Connor loves to tell us frequently, Mama, take a breath. Take a breath.
Oh
So it's
yeah,
great to get that feedback and know that, okay, well, great. Thanks for telling me I'm dysregulated. You're not wrong. All
you're
right,
not
let's take a
wrong.
breath. Thanks for calling me out on my stuff. Okay.
So
But
it's
yeah,
this.
and then repair matters more. Like after the storm has passed, repair and connection and reconnection and reestablishing trust and safety is more important than what actually happened in the moment a
Absolutely.
lot of the time. So, and just being there so that they know that they can return back to that safety. If that's modeled over and over again, and then you're, doing nervous system regulation support with them, then they'll be able to start regulating themselves more, and hopefully the explosions or the behaviors and everything start to soften and lessen over time,
Time.
and the ability to recover quicker tends to come as well. Not that it's magically ever going to go away, but if they can shift out of that and back into where they need to be, quicker
That's the goal.
and more completely, that's huge.
So we have someone raising their hand. They have a question, and it's 6:14. So I that's totally great. Let's open it up for questions. But I would just remind everyone that this is being recorded, and it's our intention to share it in different platforms to help parents. So just be really careful with specific information about your child. So. It says somebody has a raised hand, and I think you can just unmute and ask. I don't think I have to do anything. See if that works. It's Smoking Crow. There we go.
Ooh, cool name.
Are you there?
Oh, I think she said
Oh,
never
never
mind.
mind. Okay, never mind. So, anyone, if you have questions to ask, please don't hesitate. Just unmute and ask, or you can drop a question in the chat and we'll talk about it. If not, I'm sure we can find some other things to talk about. I have a few more questions here. Let's just make sure that there's no questions lurking there that I've missed. Yes, it is ridiculous, the list of things we're told that our children will never do. Just ask them. Okay. Okay, so that's it. So anybody, if you have a question, feel free to ask. Um, I was going to ask about the use of sound. So this isn't even on my page. I was just thinking about it as you were talking. I remember when Lucas was very little, we did Tomatis. He was like 18 months old. He was very young. And for anyone who doesn't know what that is, it's a sound program and it is several days of high frequency, like violin rich content, like Mozart, into his ears, and then several days of a basal tone. I believe they use like Gregorian chant or like a Baroque. And interestingly enough, when we finished that, he was just over 2 years old, he started indicating that he needed to use the bathroom
Mhm.
for bowels. And he actually became continent of bowels using the toilet shortly thereafter. And I think that basal sound, that basal tone has a metabolic component to it. And I don't know that for sure. I just wondered if you do work with sound.
Yeah, I work with sound on different ways. With quantum neurology, it is a functional nervous system rehabilitation technique, and we heavily work on cranial nerves with it. So, of course, I would be looking at cranial nerve 8 and making sure that that was functioning well and had a good threshold for its ability to take in stuff. Um, and then I think sound therapy is one of those really kind of underutilized tools that we have. I think it's often seen as kind of woo woo still, when unfortunately, yeah, it can be really powerful, really impactful. And that's why you've seen throughout history, chanting and singing and the vocalization, because it does have an overall tonifying and healing effect on the nervous system. So, yeah, I can totally see, if when you're speaking, singing, gargling, that all activates the vagus nerve. So, for me, and when the vagus nerve is getting supported, then digestion is going to work better. So even though like the bowel and the bladders aren't directly innervated by the vagus nerve, they are going to be indirectly influenced by the vagus nerve. So sound, I think, is great. I love using like the little Tibetan singing bowls, if they're back there.
Mm-hmm.
Um, and I think that's why so many kids like listening to music and respond to music, because it overall feels good in their body and helps to support their nervous system.
Yes. We do have a question. Would being very gassy be a sign of nervous system issues? She's gluten and dairy free, takes probiotics, cannot figure out why she's so gassy, and I'm thinking maybe stress.
It definitely could be. I mean, there could be other things as well, but yeah, the especially the vagus nerve has a lot to do with digestion. And our kids tend to have poor digestion for multiple reasons. There's digestion starts first with looking at the food. And I think a lot of times in our culture, we just kind of shovel and we're not chewing well enough. And we're not taking that moment to actually be in a parasympathetic state when we're eating. We're eating on the go, which is eating in fight or flight, which is two opposing nervous system states. So learning to slow down and make eating more intentional, um, encouraging your child to chew, which I know is a whole other challenge. Um, when you're stressed, your digestion shuts down. Everybody tends to think, oh, the reflux, the belching, the bloating, all of that is because I make too much stomach acid, but that's physiologically not accurate. Most of the time, when you're stressed out, you're in fight or flight, digestion gets shut down. If you're being chased by a tiger, you don't need fuel and energy going to your digestive system. It needs to go to your muscles so you can escape the tiger. So that's why digestion gets shut down when you're in fight or flight. So that means stomach acid is not released. And then if stomach acid's not released, then sphincters do not open and close properly. And proteins, fats, and carbs don't get broken down properly, which means food is in fermenting, putrefying. And then when it gets dumped into the intestines, it's not broken down enough, which puts more stress on the digestive system. So yes, digestive stuff definitely can be related back to the vagus nerve and nervous system dysfunction, but it's a piece I would look at. I wouldn't ignore what's going on with nutrient deficiencies or infections or scars or anything like that. But it definitely is a piece. And the thing is, if you want your supplements to work better, you got to work on the nervous system regulation because the body has to be in that receptive state for the supplements to be digested and assimilated and be able to work.
I see Jamie has her hand raised. I see Smoking Crow still has their hand raised. So if you changed your mind, just unmute and ask away.
Hi, this is
Caution,
Jamie. Can you hear
terrain.
me?
Yes,
Caution,
Jamie.
terrain.
Okay.
Caution, terrain. Caution, terrain.
I don't know what that is.
Caution.
That's okay. Go ahead, Jamie.
Okay. So yes, I had a quick question. So it seems like the pot to pick from is many. So I'm just curious if there are just maybe like in your experience, and I know every child is different, but like top three regulatory things that you would kind of just start with. So my daughter, she's only 3 and she just turned 3 yesterday. So she's a little one. So some of the things that were mentioned, like especially maybe even with like the sighing or the humming, like she's just not there yet to even
Right.
be able to do those things. So that was one part of the question. And then the second part of the question is I know you had talked a little bit about just this idea of not everything going on systemically is necessarily a vagus nerve
Right.
problem. So, in your experience, what would be some other areas, whether it might be through lab work or digging a little deeper to see if there can be other causative factors that are not necessarily, a direct correlation to a dysregulated nervous system, if any of that made sense?
Okay. Okay. So top three is a tough one because, like you said, it kind of depends on where your kid is at. I would say one would be the spinal flush and zip up, unless your kid really doesn't like to be touched. If they don't like to be touched, that tells me their sensory nervous system really needs integration and support. And so I'd be building towards that. But most kids do like to be touched. So I would look at that spinal flush and zip up. I like the butterfly tapping. I think that's something you'd be able to start modeling and getting your kiddo to do. If your kid can vocalize, then even g, 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 those types of vocalizations help to stimulate and support the vagus nerve. So I would do like a couple of different ones. So the spinal touch one, a tapping one, and a vocalization one, if your kid can do that. The lab, how do you tease out if something's the vagus nerve versus something else? I mean, that's a great question. There's not going to be labs that are really going to tell you that, because the thing is, if like say your child has gut issues and you do a stool test and oh, there's this overgrowth and there's too much of this or whatever. Okay, that's well and good. And you still need to address that, but how much of that, what's the chicken egg with that? How much of that is caused by nervous system dysregulation or as a result of nervous system dysregulation? So usually the answer for me is that it's probably almost always going to be both. And for me, a truly holistic program is going to merge those biochemical and diet pieces with the lifestyle pieces of some type of nervous system regulation practice. The nervous system in Down syndrome is just so compromised. The neural, from an anatomical and physiological perspective, parts of the brain are smaller. There's less of a neural net. So there is a structural component to that, which then, of course, translates into the function of it. So that's why I feel really safe in saying there's probably always going to be at least some nervous system component with it. And since that nervous system regulation piece is so important for the body's ability to heal and repair and regenerate, it's important to do the nervous system piece along with everything else.
Thank you.
Thank you, Jamie. Smoking Crow, I see that you now are in another window. So if you have a question, you can unmute.
Pull up. Pull up. Pull up.
Some very exciting sounds on the podcast here.
Absolutely. Excellent. Okay, let's see.
I think I saw her question. I think it was about her son and spitting. Is that correct?
I remembered it. I don't see any. Am I missing it?
I saw something pop up about my son, I think is 15 and is spitting. What should we look at?
That is Susanna.
Oh, okay.
First, Hannah asks what your thoughts are on vibration plates.
I love vibration plates. I think vibration plates are great because they give so much nervous system input, a lot of nervous system input. So sometimes that can be, again, too much or too overwhelming. So my biggest thing on that is starting low and watching to see how it's received and then building up on time. But if your child's nervous system, if you can build their nervous system resilience to a place where they can tolerate vibration and then start stacking in other things as well with the vibration, that just gives kind of a really strong, almost exponential growth for the nervous system. That's why like people will do workouts on vibration plates, just like even doing a push-up and doing like squats and stuff on the vibration plates yields you more results than just doing squats and push-ups by themselves. It's the same thing for other nervous system functions. So for me, if like a patient can tolerate being on the vibration plate and it's not causing stress to their nervous system, which is what I assess through quantum neurology, then we start stacking other functions on top of that. We'll start checking each cranial nerve, or we'll check myotomes, or we'll check sensory pathways while they have this stimulus, because the more things we can layer in and strengthen and upregulate that nervous system, the more it's able to take on and be more resilient. So I like vibration plates. Just start low and slow, make sure it's being tolerated and not stressing your child out, and then build up from there.
Susanna said, my son is 15, nonverbal, and he's spitting a lot. What do you think we should check?
I would check cranial nerves and see if there's something there. I'd definitely be looking at vagus nerve. I'd also be looking at things potentially like reflux, and see if there's, I don't know the context of the spitting, so it's a little bit tricky to say.
I'm thinking as well, the desire for proprioceptive
Yeah,
stimulation,
absolutely.
the spitting, it could be a number of things.
A lot of what we call stims is the nervous system trying to communicate with you where it needs the help, where it needs the support. Um, so that's something we talk about and address with quantum neurology quite a bit. So, if there's hand flapping and stuff up here with the vision, then we look at those cranial nerves. If there's the spitting, if there's a lot of stuff with the mouth, then we'd be looking at like facial nerve and cranial nerve 9, cranial nerve 10. So a lot of times what you're seeing as a stemming is the nervous system trying to tell you what's out of balance.
Um, Smoking Crow asked if they can share their screen, and I'm wondering if it's a communication device. And I am not sure how to um, how to allow a participant to share their screen. Typically, if you send a request, it would pop up, but I haven't seen anything pop up that I can approve. Um, I will continue looking at that. Can you potentially type your question into the chat and at least we can get you the information you're looking for while I work on this? And then, secondly, while I figure that out, Tom said, when I've searched for vibration plates, there are so many options. They seem to be all oriented toward adults. I'm looking for one for a 3-year-old and a 5-year-old. Do you have any recommendations of what I should look for?
I don't. I have one, I think it's called a Juvent, and it's small. I know the vibration plate thing can get really crazy. Like it has to be moving in the XYZ axis versus this axis and all this kind of stuff. I think where I'm at with that right now is just get something that works within your budget and works within your household and something that like your kid could probably sit or lay on, because that might be where they need to start versus standing. Geraldine, what do you think about that one?
I like Honestly, I've had my vibration plate for many years now. It was like a cheapie off of Amazon. I just
Mm.
made sure that it was, adjustable so I could slow it down if I needed
Yeah,
to. Um, and then, just work to his tolerance. We got it when he was much younger. So if he wanted to sit on it, we let him sit on it. And,
yeah,
before you knew it, he was willing to stand on it. So it was kind of like
right.
self-led. I think the key is just that it's adaptable, that you can slow it down if you want to.
Yeah.
Um, I just changed the controls, so you should be able to share your screen if you'd like to. Um, in the meantime,
Let me
Susanna,
go back to Jamie's question real quick, if I can, about like
yes.
the top three
Oh, yeah. Uh-huh.
and why that's a tricky one, because that's why I am doing a vagus nerve course that starts on Monday. And what I'm going to do is it's called a 30-day course because it's supposed to be like teach you a different exercise each day, except I'm not teaching live daily. I will teach once a week and give you 7 exercises. But the intention with that is to give you exposure to enough exercises, because we're going to have at least 30, that you can take that toolbox of vagus nerve exercises and be like, oh yeah, these 3 I can definitely do with my kid right now. So I think having a set of exercises that you're familiar with and you can choose from will give you better success of doing it with your child and teaching them to your child.
I was going to ask you, tell us about your program. I saw you posted it. I'm very interested. Is it a situation where there is like scheduled components to it, or is it patient-led, a parent-led experience?
Well, basically, I'll be coming on 4 times live and I'll be teaching at least 7 exercises per session. It's all going to be recorded so that you can go back and either rewatch it, or if you miss the live, you can see it. And it's designed for both parents and kids, short, doable daily practices. It's not like a big full program. I mean, the last thing I want to do is stress somebody's nervous system by trying to teach them how to heal their nervous system. But you still need guidance, you still need support, and I want to give you that toolbox that you can pull from. It's going to focus on vagal tone and safety cues and nervous system literacy. There's no equipment needed. And it's a foundational program for you to learn and experience, and for your own empowerment, and that you can also teach and empower your own child with their nervous system. It's going to help you feel what regulation actually feels like, not just an intellectual understanding, so that you can be in that nervous system regulated space. And I just feel very impassioned about it because we focus so much on our kids, and we need to. And I think so many moms end up putting themselves last. And, we see throughout the special needs community how stressed out everybody is, how burnt out everybody is. But we tend to put more of our resources towards our children. But, we're in this with our kiddos for the long haul. So I really feel that we need to be supporting ourselves and our own nervous system, because we don't know what's going to be coming at us down the road with our child and what their experience is. And so even if you don't end up doing this for your child, I encourage you to do this for yourself, so that your nervous system is in better shape, so that you have the better regulation to heal and to repair and recover and rest and relax. So there's going to be some bonus material. It's going to be an evergreen course, so you'll be able to take it whenever. But yeah, I'm very excited about it. And hoping not to overwhelm people, but I also want to give people enough so that they're like, well, I know I can't do that one with my kid, but I can do this one with my kid. And I like this one for myself. I think it's important to have those choices and those options, because sometimes when your nervous system is really in a state of overwhelm or freeze, even what at other times look like it would be a simple thing isn't. So, you could be in a state where you're too shut down to sing or to gargle or to breathe, but you can do this or some of the other exercises. So that's why I'm giving many exercises, and there'll be, handouts that reference what those are. So you'll be able to print that out and refer back to it. But yeah, I'm very excited about it.
I love that. And then finally, if someone wishes to have a one-on-one conversation with you for consult or for getting more information, how should they get in contact with you? What's the best way?
Well, it's a good question. My clinic website is just about back up. That is experiencehealth.org. It's accessible through Facebook. That's how most people kind of get to me. Though I'll be not transitioning off Facebook, but encouraging people to get to me through other ways for my own nervous system protection.
Yes.
A lot of this work has not only come out of my experience with working with kids with disabilities over the last 25 years, but also needing to recover my own health from my own burnout and dysfunction. So all this stuff is kind of tried and tested and has worked at different levels at different times, which is why I want to offer things the way I'm offering them. But Yeah, so I would say Facebook, or my Down syndrome website is one extraordinaryjourney.com. And there's contact me information on that as well.
And if there are questions remaining that we didn't get to tonight, or if we post this video and people have questions, would it be all right with you if I kind of tag you so you see them?
Yeah,
Okay.
yeah, absolutely.
I can't thank you enough for coming on and having this conversation with me. Um, Now, I think I'm probably going to be pestering you a lot more because I have about 10 other things written down that I want to talk to you about.
That
And
sounds
I
good.
think and I think that conversation would benefit so many other people that I would love to do it on this format so others can join us. Thank you so much
You're
for
welcome.
coming on and giving us your time. And I'm looking forward to your vagus nerve course, some information, um, and just honestly, what an inspiration. Thank you so very much for your time.
You're welcome.
I am going to stop recording right now and then.
Oh, I can't be